Dr. Choi, Gabby's been short of breath for the last few minutes.
Sats are at 91. April, let's get her on oxygen.
Is there any news?
That's what I came to speak to you about. Please. Gabby's CT did in fact show cirrhosis, and her labs, I'm afraid, are consistent with liver failure.
Oh my God.
What? How could that be?
I have a theory, but I'd like to do a quick exam to confirm. Excuse me. Hey, Gabby. Can you look into the light for me? There. See the golden color around her pupils? Those are called Kaiser-Fleischer rings. They're a sign of Wilson's disease.
What is that?
Well, when our bodies consume copper, our livers get rid of the excess. But with Wilson's, the copper isn't properly eliminated, so it builds up in our vital organs. It's a hereditary disorder. Any family history on either side?
No.
I'm not sure. No.
Can we step outside for a moment?
I'll keep Gabby company.
Thanks. Right now, we're gonna start Gabby on plasmapheresis to remove the copper from her blood. But ultimately, she will need a liver transplant.
Well, can we donate? Is that possible?
Yes, because the liver regenerates, it's possible to donate a segment. We just need a test to see if either of you are a match.
Can friends and family get tested as well?
The wider the net, the better.
Good. We'll, reach out to everyone we know.
In the meantime, we'll set you both up to get evaluated. Thank you.
Hey, results are back for Gabby's dad. They couldn't test her mom.
How come? Pre-existing condition?
Lupus.
Dad?
Unfortunately, he's not a match.
John's blood type is AB, Gabby's type O.
He can't be her biological father.
Remember how Jeanette changed her answer when I asked them about their family history?
John probably has no idea.
I'm gonna pull in Dr. Charles.
So if John's not a match and I can't donate, what now?
Miss Phillips, it is not at all our intention to pry into your private affairs, but at the same time, it's important to us to give your daughter the best care possible.
Okay.
In reviewing your and your husband's test results, it became evident that John is not Gabby's biological father.
And we wanted to meet with you in private because we weren't sure that John knew.
No. It's not what you think. Gabby's adopted.
Huh.
Oh, when I asked about your family history, you didn't...
No, we don't want to say anything in front of Gabby. She doesn't know.
Mrs. Phillips, I know it's a stretch, but if we could locate any of Gabby's blood relatives...
That's not possible. Gabby was a ward of the state when we adopted her. Her biological parents were deceased, and she had no other known relatives.
Well, in that case, we'll want to get Gabby onto the transplant list right away.
Thank you. Dr. Charles? Hey, I was wondering, how long does Gabby have to be on the transplant list before she gets a new liver? Please, just level with me.
I'm afraid I can't give you a definitive answer. It can take days, weeks, sometimes, honestly, even years.
Years?
Well, unfortunately, demand vastly outweighs supply. It's why living donor transplantation was developed.
It's not possible for a drug addict to donate, is it?
A drug addict?
Honey, I got you a coffee.
Oh, thank you.
Any word from Paula?
No, she can't.
She's having a seizure. 5 of Ativan IV.
Gabby?
Let's get a brain CT just to make sure there are no bleeds.
Bleeding in the brain? What are you talking about?
Just a precaution. Here, let's let them do their job.
John?
Ativan's in.
Easy.
Dr. Charles, my wife, this whole thing has been really hard on her. She and Gabby haven't spent more than a night apart since the day we adopted her.
Imagine it's incredibly hard on both of you, right? I mean, the stress, emotions gotta run high. We all say things, do things we regret, right? Look, not for nothing, I'm here. You wanna talk about anything? Anything at all?
No. You know what? You make a good point. I should find Jeanette. I owe her an apology.
Any word on Gabby's CT?
It was negative.
Oh, well, that's good. Look, I've been thinking, Why don't we see if we can get a look at Gabby's adoption records? Sometimes courts will unseal them in the case of imminent medical need.
But didn't the parents say Gabby's the ward of the state with no surviving relatives?
Yeah, but at this point, I'm pretty sure there's something they're not telling us.
I'll make the call.
Hey,
Hey.
got your page.
Just heard back we can't get Gabby's adoption records.
Why not?
Because they don't exist.
Okay, so the state made a clerical error. Or they lost our adoption record. I fail to understand how this is our fault.
No one is blaming you.
And what were you doing going behind our backs without our consent in the first place?
Mr. Phillips, please just try to stay calm.
Jeanette, you asked me before if an addict could donate.
Leave my wife alone.
I need you to know that if they're clean now, they very well could.
Really?
I know how much you both love your daughter, but if you're withholding information that could help us save her life, now is absolutely the time to tell us.
We had to do something. We couldn't just leave her there. Gabby was just a baby. She wasn't even a year old. And she'd leave her out in the hallway for hours in this ratty old bassinet. We'd hear wailing from our apartment.
Who would leave her?
That woman, the mother. She was inside getting high. She was strung out on who knows what.
We were just gonna take her up to our apartment for a night, I swear. Give her a bath, get her fed.
Wait, you kidnapped her?
No, it's not like that. We had to save her.
I'm sorry, but you know we have to report this.
We know. Could we have a moment with Gabby to try to explain?
Of course.
I'm sorry. I'm sorry.
It's okay. It's gonna be okay.
The birth mom, Melissa Thompson, is on her way in. We were able to track her down with the info that Phillips provided.
Is she clean and sober?
Seems like it. Been working as a hotel maid for the past 6 years.
Good. Hopefully she'll be willing to get tested to be a donor.
Yeah, nearly had a heart attack when we told her we found her daughter. Mr. and Mrs. Phillips, gonna need you to come with me.
Wait.
We're so sorry, baby.
Oh,
We have no choice.
I'm sorry. Can you do something? Can you? Please forgive us.
I know this is very scary.
It's all of your fault.
Is that Kylie? She goes by Gabby now.
I can't believe all these years I thought she was dead.
Would you like to meet her?
Yes.
Gabby, I think you have a visitor. Alyssa is here.
Hi. I'm so happy to see you. You are so beautiful.
Get away from me.
You're not my mama.
Gabby, I know this is
I want her out of here. I don't care. I'm not here to hurt you. Get out. Get out! I get it. I wouldn't expect her to. But I just thank God that I get a second chance to be in her life in some way. To be some kind of mother.
Thank you for agreeing to get tested.
Anything she needs.
If you follow me, I'll get you started.
Excuse me. The couple that took her, where are they?
They're in police custody.
I was hoping I may be able to thank them. They saved her life.
Thank them. Wow.
motherhood, you know, mysterious, powerful thing. Something you and me never fully understand.
It's a monster!
Kill it!
Baby's temp is 94. I need more blankets.
Versad's in.
I start an IV, get 2 units of Bonagle to rapid transfusion, start the MTP.
Vitals at 86. Turn the O2 up to 10 liters.
I got the placenta.
Heart rate's down. Pressure stable.
Baby's starting to pink up.
Hey. Hey, listen to me. You just had a baby. That's your baby.
Baby?
Call Child and Family Services. No way she's taking this baby home.
Dr. Manning,
What's going on?
he's inconsolable. I've tried rocking him, swaddling him, singing. Nothing I do calms him down. Heart rate's in the 190s. O2 sats have been dropping.
Has he been feeding?
No, nothing. Is it possible he's still in shock from the cold?
I don't think so.
I'll go see if his labs are back.
That won't be necessary. He's addicted to heroin. And he's going through withdrawal.
I heard about the baby. Neonatal abstinence syndrome. That's a rough road.
Yeah, I'm giving him fluids, Ativan, and aspiration precautions, but his numbers aren't getting any better. How's the mom?
Just wants to get out and get her next fix. Why?
Studies show that babies who are not thriving actually do significantly better when they have physical contact with their biological mothers.
So?
So I think we should have Leanne hold him for a little bit.
You can't be serious. She'd try to kill him.
She would be supervised. Even hearing the mother's heartbeat can lower cortisol levels and stress.
Leanne had 9 months to do right by her baby. She lost that chance.
Dr. Charles,
Well, I appreciate your concern for your patient, Dr. Manning, but I'm also concerned for mine. I mean, here's the problem. That baby's going home with somebody else. We let Leanne bond with him and then just rip him away. Any chance we have of helping her, we're pretty much going for good.
Dr. Charles, we're talking about an infant's life.
I'm aware of that, but I just think that we should take a beat and look at all sides of this.
Excuse me, Dr. Manning, DCFS is on their way. They've got some foster parents that might be interested in caring for your patient.
Ms. Crawford,
I told you I don't want to talk.
I'm not here to discuss detox. I want to talk to you about your baby.
What about it?
He's a boy, and he's withdrawing from heroin. He's not eating, not sleeping. Breathing and heartbeat aren't quite as regular as we'd like.
So give him some medicine.
Well, we have been, but it's not quite that simple.
Okay. So?
Leanne, adults have years to develop the coping mechanisms that help us get through life's trouble spots. A newborn doesn't have any. For him, his mother is the only thing in the world that makes him feel safe. Being held by her, feeling her skin.
You want me to hold him?
Well, it might be the best medicine we've got.
I don't know how to hold a baby.
Well, we can show you. We can teach you how to do that.
But this baby's sick because of me, right? There's no way that more of me is gonna help it.
Well,
Listen. Please leave me alone.
How are you feeling?
Fine. You don't think I should go see my baby, do you?
That's up to you.
They say he's sick.
Yeah, he is.
I never planned on getting pregnant. You know. Whatever. You think I'm terrible.
I just wish things had worked out differently for you and your baby.
Yeah. But I guess where you're from, things work out great for everybody. Why would you understand?
Actually, I understand a lot better than you think.
Dr. Manning,
What's happening?
he's having a seizure.
Give him a bolus of Ativan. O2 sats are down to 72. He can't get any air.
Bolus is in.
He could suffer an anoxic brain injury. Give him 0.1 milligrams of morphine.
So that's down to 67.
He can't go much longer. Give him another 0.1.
So that's back to 77. 81.
He's breathing. Get a pediatric intubation kit. If this happens again, we're gonna have to put him on a vent.
And he's gonna die.
He could. Yeah,
And you really think that having me hold him is gonna help?
I know it's a lot to ask, and I just wouldn't be doing it if the situation wasn't so dire. But you're his mother, and the baby needs you. And if there's any chance at all that you're holding him might help him get better, you think we should try?
This is my fault. I did this to him. Okay.
Okay.
He's so small.
Go ahead.
Hold him close now. Against your skin.
Hi, don't cry. Yeah.
Right there.
Oh, excuse me. Can I just have a quick word with Miss Crawford first?
Okay. Hey.
Oh, wow. He looks great. A lot better, huh?
He is great.
So, they have finally made some room for him in the intensive care unit. So we're gonna take him up there now.
Okay. Oh, do I carry him up or do we take him up in the warmer?
Well, actually, Leanne, there's a foster couple up there who's gonna be looking after him from here on out.
But he likes me so much.
I know.
And he is doing so well. So I should just keep holding him.
I really wish you could. Really, I do.
But you said that he needs me.
I know I did. I know how difficult this is. I really do.
I'm sorry, but we need to take the baby now.
No. I'm his mother. I'm his mother. Wait, Dr. Charles, please.
Sorry.
You know. Dr. Charles, please, can you help me? Please, can you help me? Just explain to that is my baby. Dr. Charles, please, can you just... Dr. Charles, can you...
Talk to me, Chop.
Julia Dutra, 34, pregnant, power 1, gravita 0, fainted in a yoga class. An AFib at 150, BP 90/60.
Hi, Julia. I'm Dr. Manning. This is Dr. Halstead. I told them I don't want to be here.
Hopefully this won't take long. On my count. 1, 2, 3.
Julie, are you okay?
I'm fine. Just call Mira.
Our midwife. I think Julie would be more comfortable at home with her.
Sir, your wife's in a dangerous arrhythmia. We can't let her go until we get it under control.
Do you have any history of heart disease?
No, I don't eat red meat, and I keep a high antioxidant profile to minimize inflammation.
Okay, good. Let's get an EKG, cardiac lab, CBC, CMP, coags, and a UA, and let's start 5 of Rapamil IV, okay?
No medications.
This one's safe for pregnancy.
If we don't control your arrhythmia, it could put the baby in danger.
Is that true?
Scott.
What? We don't want anything bad to happen.
Okay, fine, but then we're leaving.
Thank you. All right, let me ask you a few more questions.
Wait, what are you doing?
Just a quick fetal ultrasound.
Oh, get that thing off me.
Acoustic radiation impairs neurodevelopment.
That's not actually true. Note that the fetus measures normal size and weight for 5 months.
Wait, what did you say?
That this looks like a normal 5-month pregnancy.
Measure it again.
I'm sure of the numbers.
Well, you're wrong. Measure it again.
See? Totally normal for 5 months.
Except I'm not 5 months pregnant. I'm 8.
Julie's labs.
Anemia, vitamin deficiencies, all the signs of early kidney failure.
No family history of troubled pregnancies or genetic conditions.
Maybe a malabsorption syndrome?
Miss Dutra, have you ever had any gastrointestinal issues, Crohn's, ulcerative colitis?
I used to have leaky gut. At first, we thought it was just lactose, but of course, it was more complicated than that.
Okay.
I see. And were you seeing someone for this?
My nutritionist, she got me off lecithin and phytic acid. It helped some, but then once I got pregnant, I had to give up all GMOs and anything that wasn't locally sourced, too.
So what do you eat?
Certain strains of Swiss chard, broccoli. Sometimes I'll have a cup of adzuki beans.
But she supplements a lot. Selenium, coenzyme Q.
You eat 3 meals a day? More? Less?
I do portion control to manage the baby's glucose. 700 to 800 calories a day. Why?
We suspect the difficulties with this pregnancy are being caused by your diet.
That can't be. I only eat organic.
But you're not getting enough protein or iron.
And we're seeing the effects it's having on your baby. We need to start aggressive IV nutrition to help it grow as much as possible before you deliver. If we admit you to obstetrics now, I understand that you don't want to be here, but at this point,
you're not giving me IV food.
Your baby is severely malnourished.
No, my baby is getting healthy farm-to-table nutrients. You're not going to pump him full of toxins and chemicals.
Miss Dutra.
I said no.
Your arrhythmia hasn't resolved yet. We'll be back in a minute to check on you.
She's starving that baby to death.
We need to talk to Goodwin. Yeah, your heart isn't responding to the meds. If things keep going in this direction, we may need to consider an emergency C-section to take the extra load off your heart.
Drug me up and cut me open? No way.
That's not what we want either, but we do need to protect you and your baby. That's why in the meantime, if you allow us to give you some IV nutrition—
No way. Those bags off-gas PPAs? Look, you don't get it. This baby is being formed from every single molecule that enters my body. It is my job to keep it absolutely pure. That is how I'm protecting it.
They understand
No,
that.
they don't.
Excuse us. Please tell me you have some good news.
I'm afraid not. The committee ruled that we can't intervene against her wishes, not even for the sake of the baby.
So that's it. We just have to watch as she lets the baby die.
If that's what she chooses to do.
But that's not what she wants. She wants to help her baby. She's just confused about how to do it.
I'm sorry. Our hands are tied.
Mr. Dutra? Hi. I need you to talk to your wife.
She won't listen to me.
But you do understand this has gotten out of hand.
Of course I do. I mean, all she thinks about is how uric acid and compromised soil are infecting everything we eat. What do I say to that?
How did you handle it in the past?
Wasn't this bad before. I mean, she's always struggled with anxiety and control issues. But when she got pregnant, it's like she turned the dial straight to 11. Nothing's pure enough anymore. Everything looks like baby poison.
But there has to be something you can say to get her to let us help.
I am so scared my wife and my baby are gonna die. Can't you do something?
What the hell are you trying to do to me?
Please, Miss Jujar, let me
I told you no food.
Just one second.
What's going
I
on?
need you to calm down, okay?
She
Please.
put my IV behind my back.
Miss Jujar, wait.
Glucose, amino acids. You did this?
First
Miss
place.
Jujar, Miss Jujar, please.
Dutra, just relax.
Miss Jujar, we need to get you back into bed.
Get her away from me. Get her away from me.
I need some help here. All right, easy. Relax, I have her. Let's get her back up.
You're very lucky her husband convinced her not to pursue action against you or the hospital.
Miss Goodwin, I'm sorry.
I expect better from you, Dr. Manning.
Nat, wait.
I'm sorry.
I'm really not interested.
I understand. If you didn't trust us before, you certainly have no reason to trust us now.
Then we finally agree on something.
Julie, fearing for your baby's safety is the most natural thing in the world. When I was pregnant, I lost my husband. I was afraid of a lot of things. And then one day, after I had my son, I was up in a high-rise building on the balcony and suddenly had this vivid image of myself falling over the railing. And my first thought was what would happen to my son if I wasn't here for him. And the craziest part is my favorite thing in the world had always been Ferris wheels and roller coasters and being up in the air. But from that day on, I had this totally irrational fear of heights. It is really scary being solely responsible for that tiny, defenseless person inside of you. But you are letting your fear win. And it's gonna end badly. Anyway, I am sorry.
Dr. Halstead.
Her heart rate's too high and her pressure's dropping.
Baby's heart rate's down to 90.
My chest hurts.
Your arrhythmia is escalating out of control. Push 10 milligrams with diltiazem and up row 2 to 6 liters.
We need to do a C-section. We have to get the baby out.
No.
Julie, I know you don't trust me, but your baby is in real danger.
84?
Julie, let them do it.
I can't.
Julie, if you don't let us do this, your baby is going to die.
You can't do it.
Thank you. Call Abby and tell him we're coming up for a crash C-section now.
You heard her, let's move.
How are you feeling?
I'm okay. What are they putting in him?
Proteins, carbohydrates, fats. He needs them to grow. Hey, parents here?
No. Making calls outside. Looking for a new care facility.
Did you hear they want to keep the pregnancy?
Mm-hmm. When you can't talk, you don't get to say that.
Yeah, well, I don't think it's the right thing. Maggie? Did you see that?
Mm-hmm.
I know PVS patients do that, and it's just a reflex, but didn't it seem like there was more going on?
Wishful thinking.
Teresa, can you hear me? if you can hear me, please open your eyes. Teresa, if you can hear me, squeeze my hand.
My time at the vent farm, I've seen this a lot. Blinking, spasms, sudden jerks of movement. Never ends up meaning what you want it to.
Let's get a CT brain.
On a 5-year coma patient?
Just in case.
Hey, you discharging her?
Just finished the paperwork now.
Dr. Manning,
Yes.
your coma patient, given the abysmal treatment she received at that facility, I couldn't help but wonder what other ways they might have failed her, so I reviewed her history.
Did you find anything?
I'm afraid not, but I do have one question. What time of day did you perform that neuro exam?
Morning. Why?
Sometimes traumatic brain injuries results in a patient developing irregular sleep-wake circadian cycles, so it's possible Teresa's become nocturnal. I suggest we try the test again.
Great. Mr. and Mrs. Hazen, this is Dr. Abrams, Chief of Neurosurgery. Do you mind if we perform one more test on your daughter?
Well, the EMTs from our new facility are on their way.
It should just take a moment.
Teresa, if you can hear me, please open your eyes.
I've asked her that 1,000,000 times.
I know. Just bear with me a moment. Teresa, if you can hear me, please move your eyes side to side. I'm sorry. I finished Teresa's discharge. As soon as her transportation arrives,
Hold
we will
on.
get you.
There's a condition called locked-in syndrome. If your daughter has it, she'd be conscious, but she wouldn't be able to move her eyes side to side. She could, however, move them. Well, let's see. Teresa, I need you to move your eyes up and down for me, please. Up and down.
Did you see that?
What was that?
Teresa, if you can hear me, please move your eyes up and down again.
Oh my God. I don't understand. How did you wake her from the coma?
I didn't, but I don't believe she ever was in a coma.
What?
We need more tests to be certain, but it's my opinion that her accident caused a stroke to the brainstem, which occluded the basilar artery.
What does that mean?
The stroke left her completely paralyzed, but still conscious. Locked-in syndrome. She's awake, but locked in her body.
All these years? She's always been awake?
Yes.
She heard everything we said. I said.
And she was conscious? While some monster assaulted her?
Oh, my poor baby.
I know, it's so terrible. I'm so sorry. But at least you haven't lost her.
It's possible that some of her paralysis is the result of spasticity, and it's therefore treatable with muscle relaxants and physical therapy.
Will she get better?
She'll never be fully functional, but she should regain some movement.
We can also order an infrared eye tracking device that'll allow Teresa to communicate through a computer.
Communicate.
And she'll be able to put together words and sentences.
You'll be able to have a conversation with your daughter again.
A conversation with my little girl.
Thank you.
We'll give you time alone with your daughter now. Thank you.
Keep your hands off me.
Hey,
We're trying to help. We just want to take a look, okay?
What do we have here?
Dr. Choi, this is Ray Ochoa, who insists that there is nothing at all wrong with him.
That's weird. Charge nurse said he was found doubled over on the floor of a gas station bathroom, screaming out in pain.
What's the screaming in pain? Only gay-ass punks do that.
Ray, you might not be aware, but I'm a Navy flight surgeon still in active reserve. And Jeff here was an Army Ranger. Seen plenty of men screaming out in pain.
Tougher guys than me.
So, how about we take a look?
How about you suck me?
Ray, come on.
Seen this movie before. Even when he says he has something lodged up his rectum.
Seriously?
See how he's hunched up on the gurney, trying to take the pressure off the rear end, plus all the lip. The embarrassment makes him combative.
All right. Try again, X-ray.
Thanks.
Mr. Clark, what are we looking at? Mr. Clark.
Sorry, we have a safety issue. Everybody, please step out. Step out. Okay, thank you. Step out. Laura, hey, Laura, that's you. Security, over here.
What's going on?
Dr. Choi was right. There is something lodged in the rectum.
What is that, a gun?
He says he has no idea how the gun got up there.
All right. What are our options?
It's not gonna be easy getting it out. It's just past the sphincter.
Plus, the hammer's gone. So if there's a live round in there.
Seriously.
Could do some real damage. 22 single-shot Derringer. It's a big kick for a little gun.
So we work up a plan to get him to the OR. Page the surgeon on call.
Miss Goodwin, I think it'd be safer to do it here. Jeff and I both have weapons experience. We sedate him, try to slide it out. If we can't make it, then we call in surgery.
I'm in.
Should we call CPD?
Yes, we'll need enough body armor and gear to protect whoever's in there with him. And let's keep this area clear.
And I'll keep the cameraman away from all this. It's unsafe and, frankly, it's distasteful.
Thank you.
I like your tattoos. Who designed them?
Me.
You're really talented. You go to school for that?
No. Just fool around on my own.
Huh.
I saw you looking at my scars. You're not gonna ask me about them?
Do you want to tell me about them?
What, are you a shrink or something?
Not yet. Officially, I'm still training. Do you cut yourself, Ray?
I'm not crazy.
I know. What I'm discovering doing this is how we all do things that we can't explain. Things we say, things we do to ourselves. Maybe we're just experimenting, see how it feels. Or maybe we're reliving something that happened to us in the past. Did something happen to you, Ray?
Dr. Reese, Mr. Ochoa.
The hell is this? People are saying you're some kind of freak.
It's not what it looks like, Papa. It was for Wilmer.
Your cousin. That fool's in Crook County.
He asked me to smuggle a gun in for him. Said he needed it to protect himself. The guy in front of me beeped going through the metal detector. They tackled him to the ground. I guess I panicked. Ran out before they could search me. The pain must have made me pass out. Sorry.
We're gonna get started now, Ray. If you feel any discomfort, just tell us. I need you to stop moving your leg, Ray.
Where am I?
Just keep still, bud.
Almost there.
What?
Gun vacated!
Go, go, go!
You okay, Jeff?
I'm all right. How's he?
Get pressure on that. Exit wound in the right lower quadrant. We need a trauma lab. Pack the wound. Let's get him to the OR. Ready? 1, 2, 3.
All right, we're moving.
Let me take a look.
All right, watch your back. Coming through. We're gonna take us right to OR.